So hi everybody, welcome to the AMB Fitness Academy. In today's episode, we're going to be talking anabolic steroids. So are you currently thinking about using steroids, or have you used steroids in the past? Well, today we're going to uncover some facts about steroids that I think you should know. Typically, anabolic steroids are used by sports professionals, bodybuilders, and people who are looking to increase artificial muscle mass within their body over a sustained period of time. So what are anabolic steroids? Well, anabolic steroids are drugs, essentially, which are derived from testosterone. And we know that testosterone is obviously a male hormone, and some anabolic steroids come typically in a tablet form, or others are typically injected directly into the muscle. Now, there are many names for anabolic steroids. Some are Adderall, cystatin, helistonin, and decadurabolin. So with all these different names of steroids, typically we don't actually know whether we buy it from a steroid dealer or we get it from someone we know at the gym. We don't typically know what is in the steroid that we're purchasing or using. So they could be drugs produced from animals directly, and they could be completely fake or labeled incorrectly. And this is why steroids typically can become quite dangerous. So we know that anabolic steroids are very different from medicinal steroids, such as prednisolone, which is used to treat things like asthma. So when we're talking about anabolic steroids and the fact that they come and are derived from the male hormone, we want to understand and we want to present the facts. So are steroids safe? And the short answer is no. There are many risks to using anabolic steroids in both injectable and tablet form. We know that most anabolic steroids present definite risks of permanent liver damage and even liver cancer in long-term use. And it is, of course, not safe at all to share any needles when using the steroid drug. And if you typically inject anabolic steroids and share needles, you are increasing your risk of getting things like blood transmitted infections, typically hepatitis B, hepatitis C, HIV, and AIDS. So while it's true that there are many risks and side effects associated with the use of anabolic steroids, we know that over the years some examples have been very much exaggerated by health professionals and even sporting bodies and media and professional journals as well. We know that not all steroids will cause the same side effects or be specifically dangerous more or less to each individual person, but we do know the long-term side effects of steroid abuse can be very dangerous and very dangerous for things like your organs. So we know that the different side effects at different doses. However, we can never ever be sure of what correct dose of steroid is actually safe. So to sum up steroid abuse or just taking steroids, if you even think that you're taking a very small amount of steroids, we know that the side effects and the risks very, very much outweigh the benefits. There's a quote from the medical journal, Steroid Abuse, published back in 2018, which suggested that at best, if you're purchasing steroids, you may be ripped off, and at worst, you could end up taking something very harmful or contaminated. So as we've been saying to many listeners, many gym goers, many bodybuilders, many sports professionals, there is no safe dosage for anabolic steroids. There is no safe dose of an anabolic steroid in the short or long term. If you continue to use steroids, despite all the health warnings associated with the organ failure, with the roid rage, the back knee that you get. What is most suggested that you always use steroids at the very, very minimum, and always take breaks from using steroids. So this vlogcast isn't about saying that everyone's going to die of steroids, or taking steroids is going to kill everybody and we should purposely not do them. We're just using this vlogcast to highlight the risks, and even the answer of, do anabolic steroids work? I mean, the short answer is yes, even though that is controversial. So you can speak to many different athletes, bodybuilders, trainers, and even some doctors who have had positive experiences with anabolic steroids. So it's actually helped them increase lean muscle mass, improve their strength, and help them with their endurance. But there are many scientific studies that have shown that anabolic steroids, even though they do enhance performance, they can only be supported by effective training, diet, and consistent training for a sports performance or particular sports activity. You cannot take steroids on their own. You have to actually do the work as well. So will anabolic steroids work better if I use more? So the answer is no. So you must not believe everything that you read in magazines, on Instagram, in handbooks. They will tell you many, many ways of using anabolic steroids in a kind of safe or scientific way. However, any doctor worth their salt will explain that the use of steroids is just too risky long term and isn't worth the repercussions that you may experience later on in life. What is important is to understand that anabolic steroids are used in medicinal purposes or for medical reasons in certain situations. And we know typically that anabolic steroids can be used for specifically men who have certain hormonal problems, where there may be a certain deficiency of the natural male hormone. And there is lots of trials going on at the moment for actually those suffering from HIV, and the use of steroids to combat that disease. However, just focusing purely on sports performance, athletics, bodybuilding, and general gym goers, even though we know anabolic steroids do work, the repercussions again outweigh the benefits of taking steroids. So many viewers have asked us, well, yes, I've been using steroids for the kind of last 10 months. What should I do? Should I tell my doctor? And the recommendation is always yes. If you are taking steroids, please do consider medical advice. So go and see your doctor, and they may be able to do tests on you to understand any side effects from taking steroids. But they may also be able to help you with maybe some of the reasons of why you're taking steroids. So we know typically in the Olympics, within sports, so football, rugby, and all the other sports that deal with competition-based performance, we know that the use of performance-enhancing drugs are actually banned. However, the best thing you can do is to go and see your doctor to understand if you do have any noticeable side effects of steroid abuse. The best way to look at this is if you don't know what you're doing to your body, you could suffer the repercussions later on in life. Anything that's going on in your body at the moment, is better to understand what you could do now to keep yourself healthy. We've spoken to a lot of trainers who have become addicted to steroids, and it's important for those that are thinking about taking steroids that they fully understand those repercussions. So we know plenty of side effects noticeable from anabolic steroids. Some that certain people may experience more, some may experience less. So in men, typically, we know that things like baldness and acne, and particular bacne as well with men, is a common issue. Obviously, the development of breast tissue, things like diabetes increase, you can become infertile, your cholesterol levels go up. If you can imagine all that testosterone increasing the muscle mass within your body, puts higher demands on your cardiac system, and also other health problems as well, which could be high blood pressure, increased risk of heart attacks, and also fluid retention as well. So these are the typical side effects of taking steroids for men, and then for women, they can experience things like permanent deep voice or a deeper voice whilst taking steroids, because they are essentially using a male hormone to increase their muscle mass, um, largely to develop muscular hypertrophy, so to increase their muscle size, and strength as well. Women also can experience things like facial hair, acne, but can also be very damaging if a woman is looking to get pregnant or is currently pregnant. Those can have increased risks as well. So the idea of this session is to really just try and educate as much as we can. We're not telling people what to do or what not to do. We're just going to highlight the risks of steroids. The idea that is more people, or as more people become educated in steroids and understanding what steroids are, some of their side effects, and even some ways that they can even look at coming off steroids. Now, typically, for those that don't experience the side effects of steroids, they could experience things like body image issues. And especially, I know a lot of trainers who have come off steroids have a real hard time looking at themselves in the mirror. And these are the things that we really need to help support people on if they're looking to come off steroids. So you may be asking, why can't my doctor prescribe steroids for me? Well, in truth, it's actually illegal. So it's illegal for your doctor to prescribe anabolic steroids. And this is mainly in the UK. I'm not sure what it's like in the US. I can presume it's probably the same. So it is illegal for your doctor to prescribe anabolic steroids. And unless they are being used for medical reasons that we discussed earlier. So a few people have suggested that doctors should prescribe steroids so that users can be effectively monitored, and it would essentially make steroid usage more safe. Now, very few experts actually agree with this, and I'm one that doesn't actually agree with this point, because I believe that there is actually no safe way of monitoring the use of steroids. Also, we don't really know the long-term effects of using anabolic steroids. They are simply unknown. We haven't conducted the studies of long-term steroid abuse, but we have seen the effects of taking steroids very much in the short periods, typically sort of 6 weeks on, 6 weeks off, which is a typical steroid cycle. There's not enough research to identify long-term steroid abuse and some of the side effects of that long-term steroid abuse. But you can clearly see that there is no safe dose to monitor for doctors, hence why it is actually illegal to prescribe patients anabolic steroids. So a lot of people ask, can I be addicted to anabolic steroids? We don't actually know, but what we think is probably the most common denominator is that you can become psychologically dependent on anabolic steroids. So as I said earlier, lots of trainers that I've worked with over the years, they've come off steroids and they find it very hard to look at themselves in the mirror simply because they just don't feel muscular enough. So it can very much have that mental health and psychological issue with people taking steroids. Now, there's not enough research to indicate that you can become physically addicted to anabolic steroids, as you might be with typically alcohol or even certain drugs like heroin. But it is a case of becoming psychologically dependent on anabolic steroids purely to feel that you are muscular enough. And these are some of the issues that you would face typically taking steroids. And it's one of the reasons why taking steroids is not the answer. So, what are the sort of other psychological effects that anabolic steroid users can experience? So, they do say that taking anabolic steroids, users often say that they experience a great feeling of euphoria, so that high feeling of feeling empowered, and improved self-esteem, so typically feeling better about themselves. But others also say things like mood swings, violent or aggressive behavior, so typically roid rage, becoming paranoid, and even depressed as well. And this is one of the real issues around steroid abuse, that it can also be very, very mentally um, alarming as well as physically damaging. There's many facets to the effects of steroid abuse that we really want to understand. As there's only a limited amount of research that's been done in this area, it is very difficult to be certain whether a particular anabolic steroid user will get a certain amount of side effects or no side effects. It just depends on each user. So, without damaging, the kind of the reputation of anabolic steroids, we know that they are bad for us. We know that there are many side effects of taking steroids long term. And the response to questions that we often get from very kind of young trainers coming up through the gym is are anabolic steroids safe? If I check things like my blood tests, or I get regular blood markers, or I check my liver function, the answer is still no. There is no definite way of monitoring whether anabolic steroids are good or causing certain side effects on the body, on the liver, on the vital organs. Um, a typical normal blood test does not necessarily mean that your liver is normal. So you can be taking anabolic steroids for a prolonged period or for short cycles, and blood markers would not typically pick up whether you were being affected by that steroid usage or not. One thing is just to say as a caveat that if you are using anabolic steroids and if you are injecting anabolic steroids directly into the muscle, be so careful. Do not share needles with anybody. Do not use dirty needles, and make sure they're sterile every single time. This would at least decrease any risk of infection. Of course, we're not condoning the use of steroids. All we're saying is, please, if you are thinking of using anabolic steroids to help increase sports performance or develop muscular hypertrophy or become a better athlete, please be careful with how you take steroids. Like I said, just ensure that you're doing it in the safest possible way, even though we're not condoning it at all. So a lot of people also say that if I'm using anabolic steroids, how can I decrease the side effects? Well, it's hard to say, but if you are, obviously the best ways to be safe is not to use anabolic steroids at all. But if you are using anabolic steroids, always use low doses. Don't share needles or syringes with other people. Use a clean needle from an unopened package with every injection, and make sure that the injection site is sterile. That's so important to avoid infection. Avoid using blood thinners, and low blood pressure tablets with anabolic steroids. Always avoid using drugs to treat side effects of steroids altogether. Increasing the medication input is not going to help. The best way to avoid any side effects is obviously not to take steroids at all. But also, we recommend that let your doctor know. Let your doctor know that you're using anabolic steroids, so they can talk about it, and they can also help you if you're looking to come off steroids. There needs to be more discussion and support about those that are currently taking steroids and find it hard to give up. But speak to your doctor or medical professional and at least they can run some tests. At least they can talk to you about some of the side effects. At least they can educate you. And if you continue to use steroids, that's entirely up to you. But at least you'll know more about how to do it safely. And I think the final recommendation is to make sure you know exactly what tablets you are taking. If you are not sure what they are, then find out before you take them. Also, make sure any tablet you do take has not been tampered with. It is so important to ensure that you know what you're taking. It's very hard to understand the effects of medicinal or illegal drugs and the effects they have on the body if you don't know what they are or what is in them. And we know that certain, especially animal hormones, are used within the anabolic steroids scene, and those drugs are obviously very dangerous for human consumption. So where can I get advice? I mean, all we recommend is doing your research. There's lots of research online, but always we would recommend speaking to your medical professional and doctor. Your doctor will be able to advise that some of the effects, you know, they could draw bloods, they can make assessments, they can look at liver function, but they can also support you if you need it. If you are struggling to come off steroids, the best person to speak to is your medical professional. As we said before, there is no safe way of taking steroids. The best course of action is to never take steroids. But be informed, be aware, be sensible, but be safe. Okay, if you are taking anabolic steroids, please consult the professionals first and never exceed extreme doses. You can increase muscle mass, improve sports performance naturally using supplementation, good diet, good training, good programming. You don't need anabolic steroids. I hope that's cleared up a few things about anabolic steroids for you. This was never to be whether anabolic steroids were right or wrong. We know it's very different for each and every person. All we wanted to do in this audio cast was simply educate. I hope we've done that. Thank you very much for listening, and stay tuned for more episodes. Thank you very much.